Have you ever wondered what the difference is between cardiac arrest and heart failure? These two terms might ring a bell, and you've likely heard them used interchangeably. However, it's crucial to understand that they are not the same, but rather depict two distinct medical conditions. Their difference could be a matter of life or death, so it's essential to delineate between the two. In the following moments, we will dissect these two terms to help you understand their unique characteristics. Before we move on to defining heart failure, we'd like to take a moment to remind you that if you're finding this video informative and useful, please consider hitting the subscribe button below. Not only will you be supporting our channel, but you'll also be the first to know when we release more content like this. So go ahead, click on that subscribe button, and let's continue to learn together. Now let's move on to defining heart failure. Firstly, let us delve into the concept of cardiac arrest. Cardiac arrest is essentially a sudden cessation or loss of heart function. Now this might sound quite alarming, which it is, as it's considered a medical emergency. When we say loss of heart function, we're referring to the heart's inability to effectively pump blood around the body. This happens when the heart's electrical system, which controls the rate and rhythm of your heartbeat, malfunctions. This causes the heart to suddenly stop beating or beat too irregularly or too slowly to pump enough blood. Without the necessary flow of oxygen-rich blood, the vital organs of the body, including the brain, lungs, and kidneys, start to fail, leading to unconsciousness and, if not treated immediately, can result in death. Now, let's take a brief look at the symptoms of cardiac arrest. It's important to note that cardiac arrest often occurs with little to no warning signs. However, some people may experience symptoms such as sudden collapse, no pulse or heartbeat, loss of consciousness, and no breathing. In some instances, individuals might also experience dizziness, discomfort in the chest, shortness of breath, or a racing heartbeat just before the cardiac arrest. What causes this sudden halt in heart function, you may ask? Well, the most common cause of cardiac arrest is an arrhythmia, a problem with the heart's rhythm. The most deadly type of arrhythmia is ventricular fibrillation, which is a fast and erratic heartbeat. Other conditions that can lead to cardiac arrest include coronary artery disease, heart attack, or a physical blow to the chest. It's also crucial to understand that certain factors can increase the risk of experiencing cardiac arrest. These include a family history of coronary artery disease, a previous episode of cardiac arrest, age, especially if you're a man over 40 or a woman after menopause, and certain lifestyle factors like smoking, high blood pressure, obesity, and lack of physical activity. So in a nutshell, cardiac arrest is a sudden and often unexpected event, leading to a halt in the heart's function. Now that we understand cardiac arrest, we shift our focus to heart failure. Heart failure, in contrast to cardiac arrest, is a chronic, often progressive condition where the heart doesn't pump blood as efficiently as it should. Think of the heart as a pump. In a healthy state, it's a champion, tirelessly working to deliver oxygen-rich blood to every corner of your body. However, in heart failure, the pump is not as effective, and the body doesn't receive the essential nutrients and oxygen it needs to function optimally. Now let's delve into the symptoms of heart failure. They can vary greatly from person to person, and they may change over time. Some common symptoms include shortness of breath, fatigue, swollen legs, and rapid heartbeat. It's important to remember that these symptoms can also be indicative of other health issues, so always consult with a healthcare professional if you're experiencing these. So, what causes heart failure? It can be a complex web of factors. Sometimes it's due to conditions that overwork the heart, like high blood pressure or coronary artery disease. Other times it could be because of a heart defect you were born with or damage from a heart attack. Unhealthy lifestyle choices such as smoking or overconsumption of alcohol can also contribute to heart failure. But it doesn't stop there. Conditions like obesity, diabetes, and sleep apnea can also lead to heart failure. That's why it's so crucial to manage these conditions and maintain a heart-healthy lifestyle. Now you might be wondering, can heart failure be reversed? Unfortunately, in most cases, the damage to the heart can't be fully reversed. But don't lose hope, because with the right treatment and lifestyle changes, it's possible to live a full, productive life even with heart failure. In a nutshell, heart failure is a chronic condition where the heart isn't able to pump blood as well as it should. It's caused by a myriad of factors and can present a variety of symptoms. This sums up heart failure as a chronic condition that impairs the heart's ability to pump blood effectively. Now that we have defined both conditions, it's time to compare them side by side. Cardiac arrest and heart failure, while both are heart conditions, are distinct in their symptoms, causes, and effects on the heart. Let's delve into these differences. Starting with symptoms, cardiac arrest typically happens suddenly without any warning. It's like a switch has been turned off, resulting in a loss of consciousness, absence of pulse, and cessation of normal breathing. On the other hand, heart failure is more of a gradual process. It manifests over time, with symptoms such as shortness of breath, fatigue, and swelling in the legs and abdomen. Moving on to causes, cardiac arrest is primarily caused by an electrical malfunction in the heart that disrupts its pumping action, leading to an irregular heartbeat or arrhythmia. This can be triggered by a heart attack, but not always. Heart failure, in contrast, can result from a variety of conditions that damage the heart, including coronary artery disease, high blood pressure, or previous heart attack. It's more of a mechanical issue where the heart doesn't pump blood as well as it should. As for how each condition affects the heart, cardiac arrest stops the heart abruptly, preventing it from pumping blood to the rest of the body. This is a dire emergency that requires immediate medical attention. Heart failure, while also serious, doesn't stop the heart entirely. Instead, it makes the heart work harder to pump blood, which can lead to further damage over time. The key takeaway here is that while both cardiac arrest and heart failure affect the heart, they do so in different ways and have different implications for the patient. Cardiac arrest is an immediate, life-threatening event, whereas heart failure is a chronic condition that progressively worsens over time. Understanding these differences is crucial in recognizing the signs and seeking appropriate medical help. As we can see, while both conditions affect the heart, they do so in different ways and require different treatment approaches. Understanding these conditions is only half the battle. Let's talk about treatment and prevention. When cardiac arrest occurs, time is of the essence. The immediate treatment is cardiopulmonary resuscitation, or CPR, which can be performed by anyone nearby. An automated external defibrillator, or AED, can also be used to try to restore a normal heart rhythm. Once medical professionals arrive, they may use medications or other procedures to improve the patient's chance of survival. Treatment for heart failure, on the other hand, is more about managing symptoms and slowing the progression of the disease. This could involve medications such as beta blockers or ACE inhibitors to lower blood pressure and reduce strain on the heart. In more severe instances, devices such as implantable cardioverter defibrillators, or ICDs, may be used, and in the most extreme cases, a heart transplant may be considered. Prevention of both conditions involves similar lifestyle changes. Regular exercise, a balanced diet low in sodium and high in fruits, vegetables, and lean proteins can greatly reduce the risk. It's also important to manage conditions that can lead to heart problems, such as high blood pressure, high cholesterol, and diabetes. Regular checkups can help catch these issues early. Smoking and excessive alcohol consumption are also major risk factors for both conditions. Therefore, quitting smoking and limiting alcohol intake can significantly reduce the risk. Stress management is another key aspect of prevention. Techniques such as meditation, yoga, or even just taking time for leisure activities can help keep stress levels in check and contribute to overall heart health. Lastly, remember that knowledge is power. Understanding the signs and symptoms of cardiac arrest and heart failure can help you act quickly if you or someone else is experiencing these conditions. While both conditions are serious, they can be managed and even prevented with the right lifestyle changes and medical treatment. As we come to the end of our discussion, we hope you now have a clearer understanding of these two heart conditions. We've delved into the depths of cardiac arrest and heart failure, providing you with comprehensive insights into their definitions, comparisons, treatments, and prevention methods. To recap, cardiac arrest is an electrical problem where the heart malfunctions and stops beating unexpectedly. On the other hand, Heart failure is a gradual process, a mechanical problem where the heart doesn't pump blood as well as it should. Both conditions are serious and require immediate medical attention, but their causes, symptoms, and treatments can differ significantly. Understanding these differences is crucial not just for medical students or healthcare professionals, but for anyone who values their heart health. The more we know about these conditions, the better equipped we are to recognize the signs and seek timely help. Moreover, having this knowledge empowers us to make healthier lifestyle choices that can help prevent these conditions from occurring in the first place. So, let's continue to educate ourselves and others about cardiac arrest and heart failure. Let's strive to lead healthier lives and encourage our loved ones to do the same. Remember, knowledge is power. The more we understand about our heart health, the better we can take care of it. Until next time, stay healthy and stay informed.